Thank you everyone for coming. Welcome to New Advances in Lung Cancer Screening with Dr. Ida Capoe. Just a few quick notes before we begin the presentation. Please hold your questions until the end of the presentation. You can use the chat box or the Q&A when asking your questions, either or. I would like to start by thanking Hackensack Meridian Palisades Medical Center, Nikki Medeiros, Lily Irizarry, and Dr. Ida Capoe for generously donating their time to organize and appear at this event. We greatly appreciate you guys being here this evening. With more than 30 years of experience, Dr. Ida Capoe specializes in pulmonology and provides comprehensive tailored services and treatment for patients dealing with respiratory tract diseases such as pneumonia, asthma, emphysema, COPD, lung cancer, and other respiratory related diseases. Dr. Capoe provides bronchoscopy procedures to help detect lung disease. She is a compassionate, caring, and knowledgeable pulmonologist who provides her patients with the comprehensive care needed to detect, prevent, and treat patients with lung and respiratory diseases with the utmost care and diligence. She is affiliated with Palisades Medical Center and graduated from the Universidad Central del Este. Dr. Capoe is fluent in English, Spanish, and French. So without further ado, I will turn things over to Dr. Capoe.
Guys, and thank you for inviting me here to talk about something that is new to Palisades and that we've been doing, which is the lung cancer screening. Interestingly enough, in a couple of months ago, there was some updates in the lung cancer screening, and we're going to talk about these things. So in March of this year, there were new recommendations, and basically they lowered the age by 5 years. So now anyone between the age of 50 and 80 should be screened for lung cancer using what's called a low dose CAT scan. And this has been a real remarkable thing because that will include more people to be screened. And we're going to get into why that's important. So who should be screened? That's something that obviously everyone needs to talk with their physician about. And but basically, if you are between the age of 50 and 80 and are at high risk for lung cancer, you should be screened with our new low dose CAT scanner. Now, the smoking history has to be 20 pack years. And when we say that, we mean that a person needs to have smoked a pack a day for 20 years or 2 packs a day for 10 years. So if you've been a heavy smoker, then you will definitely be qualified to be screened for lung cancer. These new guidelines, by lowering the age, it used to be 55 to 80, but they lowered the age to 50. The new guidelines means that more women will be included in the lung cancer screening because women typically don't smoke as heavily as men do, but they are still at risk for developing lung cancer if they have a significant smoking history. Now, we want to ask, why is screening important? Well, despite the fact that lung cancer remains one of the leading causes of death in this country, we know that if we screen for lung cancer and we catch it at an early stage, and we encourage people to practice lifestyle changes and become more healthy, these changes will help in reducing their risk of developing lung cancer, and if we do find it, of being treated because we find it at a much earlier stage. Now, having said that, it is so important to remember the best thing to do to prevent lung cancer is to stop smoking. We also at Palisades offer the smoking cessation program, which works hand in hand with the lung cancer screening. Now, you might want to ask yourself, how do I know if I should get screened for lung cancer? Well, we just spoke about this, but just so that you can see it in a very simple fashion, if you are a smoker and you're between the ages of 50 and 80 and you have a 20-pack year history of smoking, then you qualify for being screened. Now, let's say you quit 10 years ago. Well, the recommendation is that if you've quit within the past 15 years, you should still get screened for the lung cancer using this low dose CAT scanner. So even if you've quit within the past 15 years, you might want to speak to your physician and discuss the cancer screening. Now, if the screening is recommended, what does that mean? So basically, you will answer a few questions with your healthcare provider to see if you are eligible, and they will describe the risks that are involved with the procedure, and then you will undergo what's called a low dose CAT scan. And I specify low dose because it's a CAT scan that uses the most minimum radiation needed to see pictures of the lung in the best possible way. So it's much less radiation than a normal CAT scan. Because we are doing a screening and we are specifically looking at the lungs, we are able to do it with much less radiation. It's the same thing as a CAT scanner, regular CAT scanner. It's a bed that moves under the camera. It's not enclosed, it's open, so there's no problems with being felt like you're trapped inside a tube or you can't see anywhere. It's a completely open procedure. It takes a few minutes, 5 minutes. No contrast is given. We don't have to access any veins. We don't have to give you any medication. There's no risk to the rest of your organs, and it takes less than 5 minutes. We do it at Palisades. It's a very quick procedure, but it gives us a wealth of information. Now, how does the low dose CAT scanner reduce the risk of dying? Well, unfortunately, lung cancer does not produce many symptoms until it is very late. So this is where this is very interesting to me. With a low dose CAT scanner, we can pick up very early cancers, usually in stage 1, which means that there's a 90% chance of overcoming the cancer. Most patients that we find the cancer, it is very early. They undergo surgery, the cancer is removed, and for the most part, they may not need chemotherapy. Usually radiation is needed, but it's caught at such an early stage that the chances of surviving are very good. In fact, 90% of the cancers that are detected early using this low dose CAT scanner have a favorable outcome. And for us physicians, that is a really good news because again, it's usually caught very late, lung cancer, and this gives us the chance to really pick up those patients when they're still very early in their disease. Now, what else should people know about this type of screening? The important thing is to communicate with your doctor and not be afraid. There's so many people afraid of talking about cancer, afraid of talking about their smoking history, afraid of talking or saying really how much they do smoke. But I say to you that you should not be afraid, because if we do find something, it's usually very early and very treatable. It's much better to detect these problems early and treat them right away. So I think the most important thing is to educate people and to understand, to help people understand what a low dose CAT scanner really means. I know people are very worried about radiation risk, but again, with the low dose CAT scanner, the risk of getting any kind of radiation injury is so low because we use the lowest amount of radiation necessary to get a picture of the lungs. And at Palisades, we do offer that. And then what else is important to know? Again, the most important thing is to talk to your physician or your healthcare provider, let them know how much you really do smoke. Do not be afraid. Do not lie and say, I only smoke 2 cigarettes a day, if that's not the case. Again, we have this new tool. It's relatively new. The ages have been increased so we can include more people. The smoking history has been decreased, so again, in order to include more people. And the more we do the lung cancer screening, the better off it is for our patients in general. So really the most important thing is to be honest with your doctor, be honest with yourself, and don't be afraid of getting this test. And once again, it's so imperative that if you do smoke, get the lung cancer screening, but then join the smoking cessation program to quit smoking. That's the most important. So I always like to say, what's the most important thing you can do for your lung health, for your own health? Well, the most important thing is really to love your lungs. And I once was asked, what does that mean? Well, you can see the little picture that's on the screen. It's the lungs, and they're hugging, healthy food. So obviously it's important to lead a healthy lifestyle, to eat well, to get plenty of rest, drink plenty of water. But really the most important thing for your lungs is to not put anything in your lungs other than the air we breathe. That includes any kind of smoking, any kind of vapors, any kind of vaping, anything like that. So I encourage everyone to please love your lungs and to please have honest conversations with your physician and healthcare providers to see if you qualify for this new technique called lung cancer screening with low dose CAT scan. Thank you. And please, if anybody has any questions, I'd be more than willing to answer.
And if anyone has any questions, you can either tap them into the chat box or into the Q&A box. I'm looking at both. So here's a question. What effects does medical cannabis have on the lungs if consumed by vaping and not by using any tobacco products along with it?
We don't know about vaping lung injury, but a couple of years ago, about two years ago, we had a run on vaping lung injury. Because the cannabis was the oils that were used in the vaping material are foreign to the lungs, they were producing some serious lung injury. I don't think that vaping is wise at all. I think if you are going to smoke anything, it probably should be in its most natural state, although I do encourage anyone not to smoke. But I really think that anything that's chemically made, like the vaping liquid, even the vaping with nicotine, those are dangerous to the lungs, and they have produced some serious lung injury. And we're still studying or still trying to understand what is behind what is really causing this lung injury. So I urge people, first of all, not to smoke, but if you are going to smoke, try to do it in its natural state. Not anything with oils or vapors or of anything like that.
Okay, the next is a follow-up question. What about if the cannabis is used in a vaping machine and not in liquid form?
A vaping, I don't know what a vaping machine is. All I know is when you vape, usually the cannabis comes in the cartridge with the cannabis and some sort of oil that's mixed in with it. If you're going to smoke cannabis, I suggest that you do it in its natural leaf state. I think that's the least toxic to the lungs. Having said that, anything you put in your lungs is going to develop. You are at a risk for developing COPD, and you're definitely at a risk for developing any kind of lung cancer. Although the studies we know more about tobacco, I think most people smoke tobacco more regularly and for a longer period of time than with marijuana. So we don't know as much about long-term effects of constant cannabis use on the lungs. But I would think that, again, having seen what we saw with the vaping lung injury that was occurring, especially in young people, I would highly not recommend vaping at all in any form.
The attendee said that by vaping machine, they meant a vaporizer. Does that change anything at all, or?
Yeah, I don't think so. Again, I think that if you're going to put anything in your lungs, especially if you're asking about cannabis, I would do it in its natural leaf state. I wouldn't use anything artificial that would go into your lungs. And that includes cannabis too, but I think that the vaping lung injuries were pretty severe, and we saw it quite often in young people who were using the cannabis vapor.
Thank you, Dr. Capo. The next question I have, should exposure to secondhand smoking be considered for a lung screening exam?
We have not included secondhand smoke in your lung screening exam. I, for one, in my office, if I have patients that have been exposed to a significant amount of secondhand smoke, I follow them with periodic chest x-rays as well as pulmonary function tests, because we do know that they do have an increased risk of developing lung problems further down the line. But right now it has not been looked at and is not included in the low dose CAT scanning screening program.
The next question I have, what entails in the smoking cessation program? Can you give us any details about the program?
The smoking cessation program is multifactorial, meaning that it encompasses different aspects. So first off, there's a group, right? So there's a support group of people that are quitting smoking. Secondly, we have it's like a psychologist or somebody that will speak to you and encourage you to continue smoking cessation. If you need medication in order to quit smoking, that is offered as well. We now have different drugs that are available to help people in smoking cessation. So it's like a group effort, and it's not just one person, one healthcare provider. It's more of a group effort, and we do know that people who are motivated to quit smoking and they attend a smoking cessation program, they tend to have better results at quitting smoking.
Thank you. And the next question I have, the panel, they want to know, what about a hookah? Does this impact your lungs, and can this increase your chances of developing a lung condition?
Okay, going back to my last slide. You want to love your lungs. Hookah is another type of inhalant that you're inhaling into your lungs. Yes, it can produce problems with your lungs. Anything that's not air is not good for your lungs, and that includes oxygen. So I'm including people who have to use oxygen. Oxygen also is toxic for the lungs. So anything that you are putting in your lungs that shouldn't be there other than the air we breathe is going to affect your lungs one way or another. Now, most people do hookah, at least that I've seen it, like on a social, in the social aspect. So again, if you limit the amount of toxins that you put into your lungs, the risk of developing severe illness is much less. So again, I discourage anything other than breathing fresh air.
Another question, does secondhand smoke increase your risk for other types of cancer other than lung cancer?
I don't think it's really been looked at. It's an interesting question. We do know that there seems to be an inherent increased risk for developing lung cancer, but we know that people who smoke have an increased risk for bladder cancer and stomach cancer. But I don't think that we've really associated it with secondhand smoke yet. I think you'd have to be exposed to a lot of secondhand smoke. So for example, nowadays, there's less people smoking actual tobacco. So most people are not, the people around them are exposed less. Back in the 50s and 60s, when everybody was smoking a lot of cigarettes, there was a lot of passive secondary smoke inhalation during those times. I think now more people are more aware, so that you smoke outside, or people are smoking the vapors, which don't produce that secondhand smoke.
All right. Again, if anyone has any further questions for Dr. Capot, now's the time to ask them. I'm looking at both the Q&A and the chat, so you can put them in either of those two places. And I'm just going to give everyone a couple minutes to see if there's any further questions. Oh, here's some more questions. Will inhalers prescribed by a doctor affect your lungs in a way leading towards a lung condition?
Okay, inhalers are usually prescribed because the person has a lung condition, the most common being asthma. 80% of people on inhalers probably have asthma and or some sort of syndrome similar to asthma. The other group of people that it is used in very commonly are those that have COPD, and then there's some that have other types of illnesses that are called interstitial lung diseases. So it won't produce an inhaler won't produce a lung disease. It's usually prescribed to help in a lung disease. Inhalers can produce commonly oral infections, which is why after using any type of inhaler, especially the ones that have the inhaled steroids, one should wash or rinse their mouth out. But they don't typically lead to other lung conditions.
The next question I have, I recently got a CT scan on my abdominal area, and my doctor mentioned he saw cloudiness in my lungs. What could this mean if I'm not a tobacco smoker, only a medical cannabis user?
That's a hard question to ask, and I would suggest that you ask your physician, knowing your history. It could be something as simple as irritation, or it could nowadays in this COVID world, it could mean that you've had COVID in the past. There are many reasons, and that should be addressed with your physician, and if need be, see a specialist.
Speaking of specialists, Dr. Capo, would you please share your contact information?
Absolutely. Yeah, I don't have it on the screen though, but my office is in North Bergen. I've been there for 21 years now. I'm located at 779th Street in North Bergen. And I'm part of the Hackensack Meridian family. I am the pulmonologist at Palisades, and I am also the chair of the pulmonary department at Palisades. And my telephone number for the office is 201-861-7900.
Fantastic. And again, I'm just going to give people a couple more minutes. If you have any questions, now would be the time to put them in the Q&A or the chat box. And so again, I'm just going to give people a couple more minutes to see if there's any remaining questions. All right, so it looks like we have no further questions. So I would like to thank Hackensack Meridian Palisades Medical Center. I'd like to thank Dr. Capo, of course, Nikki Medeiros and Lily Irizarry. All of you, thank you so much for coming out tonight and doing this wonderful presentation. We very much enjoyed having you this evening. And thank you for everyone who attended the presentation as well. Thank you for joining us this evening.
No.
Thank you all very much. Have a wonderful evening.
Thank you everybody for attending. Have a wonderful evening.